Hi, and welcome back to the Dr. Ramsey Show. Today, we're going to talk about prostate health, prostate cancer. I have a guest with us today who went through the treatment of prostate cancer while he was under my care. I've been in practice since 1996, and I've had 3 men develop prostate cancer. All 3 of those men are still taking testosterone, which I know that conventional medicine doesn't look at it that way. The guidelines are once prostate cancer is treated successfully, within 1 year, if your PSA is still below 0, it is safe to go on testosterone. And my opinion has always been that testosterone protects our prostate, especially in the aging years. So imagine when men are young, they have the highest testosterone they're going to have. We don't see prostate cancer. We might see testicular cancer, but we see prostate cancer in the aging years when we start to lose our testosterone. So I'm going to introduce you to our guest today, Steve Jorgenson. Welcome to the show today. Thank you for being here.
You bet. Thanks, Teresa. Thanks for having me.
Yeah. So Steve is a friend too. We were neighbors back in McCormick Ranch. He's been a patient for a long time. His prostate cancer was diagnosed in 2016, right?
Correct.
And what we did is we saw it on blood work. So that's how I see it, is on not the PSA. The PSA number, from 0 to 4 is considered normal. I like the PSA below 2.5 if possible, but it's the protective proteins. It's called percent free PSA. So what I saw with Steve in 2016 was his value was 11. So if the free PSA is above 25, that's a 0 chance of prostate cancer. If it's 10 or less, it's a 50% chance. So what we did is we started off with an MRI, went to your urologist, you got diagnosed.
I did.
Yeah.
So, yeah, and then, basically had to kind of walk through the process of what your options are to treat it or to take it out. I had a couple grandfathers that passed away from prostate cancer. And had an uncle through my mom's side of the family that had it. He took his out, and so kind of came to that conclusion that, I think just take it out of the equation and not have to worry about it later.
Exactly.
Not to say that the treatment wouldn't, keep it from not coming back later.
True. So you had a prostatectomy. And your urologist had you get off the testosterone, which was appropriate, for an active cancer. And then we met up again 6 months later after you had the surgery.
We did. Yep, absolutely. And I know we're kind of more pro about, this testosterone not being creating issues with the prostate or bringing the cancer back. So right. I think comfortable getting back on and, just based on your guidance and just the information that's out there and, obviously what testosterone does for me, I think from a daily perspective. So felt comfortable getting back on it.
Yeah. And most men think of testosterone for erections. That's good. It helps with erections in the aging process. Absolutely. It does so many other things. It helps our mental, it helps sleep, it helps our muscles. We burn fat, we build muscle. It gives us energy, focus. So many things that it's not just for erections. It's for so many different things. So when you came back in 6 months, I know the challenges we all know with prostatectomies, the challenge is impotence. And that's what most men fear when they think about prostate cancer. And so was that a driving force to want to get back on, or was it other reasons?
Yeah, no, absolutely. I mean, it was a driving force, but also, just kind of my energy level. I felt, consistency with my energy when I was on it before and had a little more peaks and valleys. So it's a combination of a few of those things going out there.
And did you have fear, I don't want to say going against your urologist, or did you have him with making decisions with you?
Yeah, we did. He obviously had mentioned to me prior to getting the prostate out to, just stay off it. He knew I was on it. And I said, okay, and didn't really talk about when I'd get back on it per se. But I think again, based on some of the information you gave me, just talking to some other people, felt comfortable going back on. And so I did make the decision to go back on without consulting with him initially. But obviously I went back in to meet with him. He kind of found out I was back on and asked me to hold off for another 6 months until I got to that 12-month mark. So I agreed to do that and then started back on. And
now your PSA remains below 0.
Yep.
And his protective proteins that were so vulnerable are over 100 now. So saying that there's no risk of prostate cancer at this point.
Correct.
And one thing that we're going to put on this video for those of you who are interested in knowing more about the research about testosterone replacement therapy and prostate cancer in the aging process, Dr. Morgan Taylor is the biggest researcher on it. And we're going to put a link. You can put that in your search engine if you want to listen to a little bit of history where the belief of replacing testosterone increases the risk of prostate cancer comes from and why it's false. That's going to be on that video. I will spare you the time. And when... do you know what your Gleason score was when you were diagnosed by chance? I think it was low.
Yeah, it was. It wasn't too high. I mean, again, I think it was at a point where again, through my history, I think, kind of felt like I should be proactive on it.
Exactly.
I mean, I probably could have not done a lot and kind of waited and maybe checked back a little bit later. But again, through my history, I chose to move forward with something.
Yeah, that's really good. So now... Your energy is good, your sleep is good, your erections are good, everything's fine working. Yeah,
absolutely. Yeah. I mean, it took a while to, get my erections back to where I wanted them. I mean, it probably took me almost a year.
Right.
But, that was probably the most challenging part about the whole process. I mean, going through the surgery was pretty seamless and, just getting my bladder working again came back pretty quickly or within 3 or 4 months,
Right.
So,
that's good.
And being in senior living, I had plenty of depends to take care of myself. I'm kidding.
So. You had a box of Depends at home.
Yeah, right. Yeah, fun stuff.
I know what men go through right after that surgery. It's not fun. But look at you now. That's really what
I'm glad I did it, went through it, and I do get calls I mentioned earlier from friends of mine or people that have gone through the same process. So happy to share and talk about my experiences, obviously. So it's been good. So
yeah, it's helpful for men, because a lot of men are fear-based. Yep. And one of the biggest risk factors is family history. So you heard Steve's family history. Even breast cancer is a risk for prostate cancer in men. So whenever there's a history and the numbers, the free PSA looks low, I'm suspicious. We do an MRI, get the diagnosis, and we move on from there. So thank you for sharing your experience. I know it's not fun to talk about, but I do appreciate you feeling the courage to come on today.
You bet. No, my pleasure, Teresa. Thanks for having me on. Yeah. So this is great.
Thank you so much. And don't forget to look at the link in your search engine if you desire to learn more about testosterone replacement, how important it is to prevent prostate cancer. It doesn't make prostate cancer worse. And one thing I'll say, I think Dr. Morgan Taylor talks on this. The first treatment for prostate cancer ever was estrogen. It worked beautiful. The problem was they used a form of estrogen called DES. So DES, a wicked estrogen, had a lot of side effects. But even today, we can treat prostate cancer with estrogen, estradiol. But I like to give testosterone if it's within the capsule. And we like to treat it once it's diagnosed. So thank you for listening. I appreciate your interest in this, and I hope you have a wonderful rest of your day. Thank you very much. Bye-bye.